Manual muscle testing for knee flexion. Before beginning manual muscle testing, resisted neutral testing is done. If resisted neutral produces a strong and painful, weak and pain-free, or weak and painful response, manual muscle testing is then done to isolate muscles with a potential problem. Manual muscle tests are graded on a scale from 5 to 0. Manual muscle testing for sartorius. The patient is lying in the supine position. The patient then flexes, abducts, and externally rotates the thigh while flexing the knee. As the patient does this, the therapist palpates muscle contraction at the ASIS. Resistance is applied on the anterior lateral thigh in the direction of extension, internal rotation, and adduction. Resistance is also applied on the posterior aspect of the leg into an extended position at the knee. Sartorius can also be tested with gravity eliminated. Gravity elimination manual muscle testing is used to assess range of motion without external forces. For sartorius, the therapist provides support on the posterior thigh proximal to the knee and posterior leg proximal to the ankle as the patient moves through the motions. Manual muscle testing for the biceps femoris, semitendinosus, and semimembranosus. The patient is lying prone with a pillow under the abdomen. As the patient flexes the knee, the therapist palpates the semitendinosus and semimembranosus on the medial aspect of the posterior thigh and the biceps femoris on the lateral aspect of the posterior thigh just proximal to the knee. Resistance is applied to the posterior leg just proximal to the ankle in the direction of extension. To isolate the biceps femoris, the patient is lying prone with the knee flexed and the tibia externally rotated. Resistance is applied in an internally rotated and extended direction on the posterior leg proximal to the ankle. To isolate the semitendinosus and semimembranosus muscles, the patient is lying prone with the knee flexed and internally rotated. Resistance is applied in an externally rotated and extended direction on the posterior leg proximal to the ankle. Gravity elimination for biceps femoris, semitendinosus, and semimembranosus is done in a side-lying position. The therapist supports the lower extremity on the medial distal thigh and the distal leg. The patient moves from an extended to a flexed position. The gastrocnemius is an accessory muscle to flexion at the knee. The patient is lying prone with a pillow under the abdomen and the ankle plantar flexed. The muscle belly is palpated on the medial and lateral margins of the popliteal fossa. Resistance is applied on the posterior calcaneus in a downward and anterior direction.
Now you try.